In this video, I will be talking about traditional Korean medicine versus Western medicine in Korean skincare. Through this video, I will explain the topic in the lens of what is tradition, what is an invented tradition, and what is compressed modernity. For this project, the research question is, how do traditional Korean medicine and Western medicine coexist in the 21st century South Korean healthcare system? The thesis of this project is the coexistence of traditional Korean medicine and Western medicine in South Korea's healthcare system is shaped by historical, institutional, and cultural factors that create collaborative and tense dynamics within the healthcare landscape seen in the beauty industry. Part 1. Definitions. In this section, we're going to define the terms tradition, invented traditions, compressed modernity, traditional Korean medicine, and Western medicine, also known as biomedicine. First, on what is tradition. In this case, tradition is defined as the acquisition of this knowledge through repeated, enculturated practices implies a social, often localized predisposition that informs one's conduct of life. In this context, this definition helps understand the background of traditions being a knowledge that has been passed down. For invented traditions, it can be defined as set of practices normally governed by overtly or tacitly accepted rules and of ritual or symbolic nature, which seeks to inculcate certain values or norms of behaviors by repetition, which automatically implies continuity with the past. Compressed modernity can be defined as a civilization condition in which economic, political, social, and/or cultural change occur in an extremely condensed manner in respect to both time and space, and in which the dynamic coexistence of mutually disparate historical and social elements leads to the construction and reconstruction of a highly complex and fluid social system. In simpler terms, compressed modernity is when a country is forced to modernize and industrialize in a short amount of time. In this case, traditional Korean medicine, also known as hangbang, can be defined as medicine that incorporates acupuncture, moxibustion, cupping, and herbal remedies. It focuses on balancing the energies of the body. It aims to balance substances within the body and the body's harmony with the world. For further meaning on the treatments within traditional Korean medicine, acupuncture is the technique of inserting thin needles through the skin at specific points on the body to control pain and other symptoms. Moxibustion is a type of heat therapy in which a herb is burned on or above the skin to warm and stimulate an acupuncture point affected area. Cupping involves placing suction cups on the skin to create a vacuum that draws blood to the surface, enhancing circulation and promoting healing. All of these are components of traditional Korean medicine and demonstrate a different approach to medicine that relies on nature and natural elements to heal the body. Western medicine, also known as biomedicine, can be defined as a system in which medical doctors and other healthcare professionals, such as nurses, pharmacists, and therapists, treat symptoms and diseases using drugs, radiation, or surgery. Based on these terms and definitions, I guided this research. Part 2. Historical factors. As I mentioned previously, I believe the coexistence of traditional Korean medicine and Western medicine is due to historical, institutional, and cultural factors. Onto the historical factor. Traditional medicine and Western medicine were both introduced through China. The article, The Rise of Western Medicine and the Decline of Traditional Medicine in Korea, 1879-1910, states, Western medicine was imported from China in the mid-18th century. Sherhawk scholars challenged the traditional views of the respected Yanban class that had dominated the Joseon dynasty in introducing avant-garde ideas through Western pragmatic sciences, including medicine. While the body is examined in detail by anatomical methods in Western medicine, and the Western practitioners are respected because of rational treatment. Along with seeing the first interactions of Western medicine in Korea was through China, it wasn't until diplomatic relations and the colonization of Korea that Western medicine was developed. In 1876, Korea succeeded in establishing diplomatic relations with Japan, which marked a turning point in the evolution of Western medicine in Korea. During this period, Japan opened several hospitals practicing Western medicine as a service to Japanese residents living in Korea. The Japanese established the Jaisen Clinic in Busan. This was the first westernized clinic initiated by Japan. As a result, Japan was a window through which Korea became exposed to Western medicine. In addition to the first clinics of Western medicine in Korea, it wasn't until the events of the Meiji Restoration and the colonization of Korea that developments in the use and access to Western medicine were seen in the country. In the article, The Rise of Western Medicine and the Decline of Traditional Medicine in Korea, 1879-1910 states that during the Meiji Restoration in 1868 produced substantial changes in Japanese society, particularly in the Japanese medical system. The Meiji government decreed the official adoption of German medicine that was social medicine oriented at the time. It caused Japan to demolish Kampo, Japanese traditional medicine. Japanese imperialists attempted to apply this medical policy to Korea, isolating practitioners from the Korean Medical Society. In order to expel Korean traditional practitioners, Sagasaki, a Japanese military doctor controlled by Maruyama, made them take Western Medicine Center examinations administered by the Home Department. As a result, Japanese ploy all the national practitioners were ousted from the government. Time, along with the restrictions, it was actively seen the degradation in status affected only a small number of elite doctors who had governmental or court posts. For the majority of traditional practitioners who did not have a high status in the traditional Confucian social order in the first place, those measures might have not affected them much. All of this to showcase the multiple issues that traditional Korean medicine faced during these times. After World War II, in 1951, the Korean government passed the National Medical Law. Basically, what this law did, it reinstated the status of traditional Korean medicine and traditional doctors, which were disregarded and discriminated against by Japanese colonialists. Thus, the current dualized healthcare system has come into being. Following these events, there are major developments in traditional Korean medicine. Part 3. Institutions. Before the National Medical Law of 1951, there was Dongyang Daehakuwon from 1947 to 1952 as the first private educational institution, and its descendant Dongyang Medical College 1953 to 1964 that offered education in traditional Korean medicine. Through these educational institutions, they were the first steps into providing formal education in traditional Korean medicine after the Japanese colonization of Korea. Even then, TKM education was dramatically upgraded in Busan National University by introducing a block lecture system, integrated lectures in basic and clinical courses, stimulating the educational style and approach of Western education. Here, this table showcases the current educational system to become a doctor of Korean medicine. It showcases the years, the paper, qualifications for entrance, examination for admissions, required years of training, and this table demonstrates the institutions that are affiliated with hospitals for tertiary Korean medicine. It provides the universities, the year of establishment, the number of faculty, admissions, credits, hours, Western medicine practices such as surgery. However, Korean medicine doctors are given liberal access to Western medicine diagnostics, although Western medicine doctors significantly outnumber Korean medicine doctors at the ratio of 4-1. Korean medicine doctors and Western medicine doctors enjoy the same social, economic, and legal status. Along with that, Eastern medicine and biomedicine doctors frequently dispute with each other regarding whose scope of practice the treatment the duty falls into. This is to showcase and demonstrate the collaborative and tense dynamics that can be seen within the healthcare system in South Korea. Part 4: Cultural Factors. What makes Koreans choose either or both medical healthcare system? That depends on the severity of the illness or disease, generational gap, and insurance coverage. For severity of the illness or disease, it has been shown and proven that utilizing both traditional and Western medicine has shown greater results than using each medical system separately. Here in this diagram, it showcases a survey in which Koreans participated, and it demonstrated a high use of both medical systems rather than using one or the other to cure or help the pain for other diseases. Another cultural factor is generational gap. In this research, some sources explain that there is a generational gap between younger generations using Western medicine and older generations using traditional medicine. Along with that, healthcare coverage is another dependable factor within the healthcare system in Korea. During this research, some sources provide information about the healthcare system and some of the issues, and not including some of the traditional Korean medicine practices. This showcases more problems that traditional medicine faces in the dual healthcare system in South Korea. Part 5: Invented Tradition. After all of this background and research information, what is the invented tradition? For this topic in particular, the invented tradition is within the Korean beauty industry, specifically the skincare. In recent years, Korean skincare has become a trend, and people around the world use many of the products offered. Within the context of invented traditions of using something old and making it appear new, it encompasses what Korean skincare is for this project. South Korea is considered to be a global leader in skincare, at the forefront of research and development of innovative cosmeceuticals that contain bioactive natural ingredients of historical traditional importance. Based on this information, having the base of multiple products be from natural ingredients and then adding Western technology, it demonstrates the perfect blend of an invented tradition and compressed modernity that can be seen in South Korea. Along with showcasing Korean skincare as an invented tradition, here this table shows the natural ingredient, the bioactive component, biological properties, potential dermatologic application, and example products. This provides an example of how natural ingredients from the past and modern technology can come together to create products that help people in their physical aspects. Part 6: Conclusion. In conclusion, going back to my thesis, the coexistence of traditional Korean medicine and Western medicine within South Korea's healthcare system is shaped by historical, institutional, and cultural factors that create collaborative and tense dynamics within the healthcare landscape seen in the beauty industry. These forces not only shape the collaborative and often tense dynamics between the two medical systems, but are also vividly reflected in the beauty industry. Ultimately, this intersection highlights South Korea's experience of compressed modernity, where rapid modernization coexists with long-lasting traditions. Thanks for watching!